All right, today we're pulling back the curtain on something that affects pretty much all of us, but we almost never think about it. We're talking about that whole complex world of decisions that happens before your doctor even picks up a pen to write a prescription. Let's dive in.
You know that moment when you're sitting in the doctor's office and you're wondering, how did they land on this specific medicine for me? Well, I can tell you it's definitely not a guess. It's actually a really precise science, and the whole thing is designed to find the absolute best treatment just for you.
And that science has a name. It's called pharmacotherapeutics. The best way to think about it is like a bridge, a super important bridge that connects this enormous, complicated world of drug knowledge with the very personal human act of taking care of a patient. It's all about matching the right tool to the right problem. So what's the goal here? What is the science trying to achieve every single time a doctor thinks about what medicine to prescribe?
It really just boils down to these three core objectives. You see, every prescription is this careful balancing act. It has to work, right? That's efficacy. It has to be safe, minimizing any nasty side effects, and it needs to be as affordable as possible. It's all about getting the best result with the least amount of risk, not just for you, but for the whole healthcare system.
So the ultimate goal, the thing everyone is aiming for, is something called rational medicine. This is basically the gold standard that every good healthcare professional is striving to hit with every single patient.
And what does that actually look like? Well, it comes down to this really simple but incredibly powerful idea. It has to be the right medicine for the right patient, at the right dose for the right amount of time, and at the lowest possible cost. See? Every single part of that sentence has to be perfect.
Now, to make sure this happens, the World Health Organization, the WHO, has laid out this super clear, logical roadmap. It all starts with correctly defining the problem. Then you set a clear goal. After that, you double-check that the drug is the right choice, you write the prescription perfectly, you tell the patient everything they need to know, and, this part's crucial, you follow up to see if it actually worked. It's a complete system, designed from the ground up for safety.
But what happens when that logical process just breaks down? Well, that's when we get into some dangerous territory. We get what's called irrational use. And honestly, this is kind of the villain of our story today.
And this can show up in a bunch of ways, some of which probably sound a little familiar. Like prescribing way too many drugs at once, that's called polypharmacy. Or, the classic example, using antibiotics for a cold, which is a virus. Sometimes it's not giving a high enough dose for the medicine to even work, or picking a super expensive brand name drug when a generic would do the exact same job. And let's be clear, this is not a small issue. The consequences are really, really serious. Irrational use leads to some scary outcomes, like antibiotic-resistant superbugs, dangerous side effects, treatments that just don't work, and honestly, a huge waste of money. Which, of course, brings us to the most important question of all. With the stakes being so incredibly high, what tools do doctors and nurses have to navigate this minefield and make sure they get it right every single time? Well, turns out they have a really powerful toolkit at their disposal, one that's been built over decades of research and practice. So let's open it up and see what's inside. At the heart of this toolkit are three guiding principles. I want you to think of them like the three legs of a stool that supports every smart medical decision. They are evidence-based medicine, essential medicine lists, and standard treatment guidelines. Okay, let's start with the first tool, evidence-based medicine, or EBM for short. This is this fantastic idea that medical decisions shouldn't be based on old habits or just, how it's always been done. Instead, they should be a combination of the best science we have, the doctor's own professional experience, and, this is key, what the patient actually wants and values. It's a triad, right? Three equally important parts. You've got the hard data from scientific research, the clinician's real-world expertise, and the patient's own preferences. All three of those pieces have to work together to get the best care. One leg is shaky, the whole thing falls apart. And there's a clear process for this. You ask a specific question, you acquire the research, you appraise it to make sure it's solid, you apply it to your actual patient's situation, and then you assess how it all went. It's basically the scientific method, but brought right to the bedside. Tool number 2 in the kit is the Essential Medicine List, or EML. Now, this is a brilliant concept. It's a carefully selected list of the most important medicines a country needs to deal with its biggest public health problems, everything from basic infections to chronic diseases. So the WHO creates a global model list that acts as a template, Then, countries, like India, for example, take that template and adapt it to create their own national list based on their specific health issues. And this list is incredibly powerful. It decides which drugs are stocked all over the country and even helps control prices. It makes sure the most important medicines are always there and affordable for the people who need them most. And finally, our third tool, Standard Treatment Guidelines, or STGs. Okay, so if EBM is the philosophy and the EML is the shopping list, then you can think of STGs as the recipe book. For a common illness, the STG will outline the best drug to start with, the right dose, and what to try next if that doesn't work. It creates a reliable, consistent standard of care. And the benefits here are just huge. For you, the patient, it means you get the same high-quality care no matter which doctor you happen to see. For doctors, it's a trusted guide to best practices. And for the whole healthcare system, it makes it so much easier to guess which medicines will be needed, which helps prevent shortages. So let's bring this all back home. These aren't just, academic terms. They have a very real, very direct impact on your health and your safety. So let's do a super quick recap. The whole field is pharmacotherapeutics. The big goal is the rational use of medicine. And the three main tools to get us there are evidence-based medicine, essential medicine lists, and standard treatment guidelines. Got it? The big takeaway here is this. Behind every single prescription, there's a powerful system of checks and balances. It's a framework built on science, logic, and care, and it's all designed to protect you and make sure you get the best possible treatment. And that leaves me with one final thought for you. Now that you've had a peek inside the practitioner's toolkit, which one of these principles do you think matters most for patients today? Is it basing decisions on evidence, focusing on only the most essential drugs, or following standard guidelines? It's definitely something to think about the next time you see that prescription pad come out.